Hey guys, welcome back to our 5-part series on how to take care of your teeth while at home. As you can see, we're going to talk about toothbrush and flossing today, but we'll start off with floss. So there's two types of floss, wax and unwaxed, and some of you guys may question what's the difference and why would we need wax floss? Well, we'll kind of dig in today on different products. We have Oral-B, there's gum brands, and another brand called Cocoa Floss. And so as you can tell, wax floss is a little bit thicker, which is also known to be a little bit stronger and less likely to tear versus unwaxed. So in my professional opinion, flossing is flossing. And the ultimate question is, do I floss before I brush or do I floss after? And the most academic answer I can come up with is similar to Nike's slogan, just do it. And so, we're going to dig into different types of floss. Now, the reason why we have wax and unwaxed floss is some patients have teeth that are tightly together, so then you'll need unwaxed to kind of get through the tight contacts, and then you have wax floss where it can also be easily used for patients who have not as of a tight contact. And in my earlier videos, we did kind of go over flossing techniques, so if you want to jump back and look at previous videos, it also walks you through on how to properly floss with both types of floss. Now for brands, what's better, what's good for me, there's a couple areas where Glide has, let's see, 1, 2, 3, 4 different types of unwaxed floss. There's Advanced, Comfort, Pro Health, D-Clean, and then Pro Health Original. There's also intradental brushes, kind of like this guy here. You can kind of see he's a little bit tapered, kind of looks like a baby bottle cleaner, and these are for areas with bigger contacts. So if you have bigger gaps in between, if you're trying to clean like under a bridge, these types of floss will help with that. Now if you're like daily on the go, on the run, and only have one hand at a time, this big package of gum soft picks are one of my favorites. They're little rubberized bristle tips. They are tapered. You can just take one and pinch off and kind of just pick through the teeth. And then there's other types from the gum brand that have more of a skinnier tapered head to it. It's very flexible. Then this one, it's a proxy brush, also known as an intradental brush, and can remove up to 25% of plaque, and it's also flexible. And then Cocoa Floss, it's one of the popular online sensations. They kind of come in the minis, and they also come in other sizes, which I don't have on hand at the moment, but they kind of smell like a pina colada or like watermelon. There's even like a chocolate sundae, and these are a little bit thicker and kind of like yarn like, so I'll kind of take some off here and let you guys kind of see the thickness of it. And they are slightly waxed and a little bit thicker. They're really strong, and in comparison to a Glide, this is more like Teflon type and stretchy and very thin. Okay. We do have floss for children. They come like little flossers with different shapes of animals or sea creatures. And for patients who have less dexterity, we have an intradental brush that has 2 pieces, and I will take this one apart to kind of show you how to put them together and how to use them. The packaging looks like this, and they're also tapered at the bottom. This one's more cylindrical, and they come in 2. So we'll take this apart, and you'll just kind of open up this back latch here, insert the wire part into this hole, and then you can kind of close and lock in the bristles And so now he's in there pretty tight once he's locked in. So now we'll take this and kind of floss in between this typodont here. And you'll just kind of go in as so and just kind of clean in and out, just like that. And you'll do it on every teeth that allows you to go in. And the reason why I say that is because each bristles are tapered differently for sizes, for different spaces. Everyone has different spacing in between their teeth. And this brand is kind of the same way as the other proxy brush, as this guy, just a different handle. And to kind of show you the variations in size in this brand, you can kind of see these are all color coded differently, which I love colors, but they're all different sizes, and here's a sizing chart, so you can kind of trial and test and see which bristles is best fit for the spacing that you have in your teeth. And Super Floss is also an awesome way to floss, especially in areas that you may have braces or brackets are in the way, or dentures, or even under implants. It's really best for implants. This is a brand new packaging, but as you can see, you have a thinner side of the floss, and then it gets really fuzzy here, and the fuzzy part here kind of stretches, and you can kind of like weave them in between the brackets and kind of clean with the fuzzy part. And the fuzzy part is super absorbent, so it'll kind of pull out any plaque, debris, or food particles that were left in between or kind of stuck underneath the brackets. So that's pretty much all for flossing. There's all different types and ways how to floss. I would just say I would encourage you just to floss daily. It doesn't matter if you're flossing in the morning or if you're flossing at night. As long as you're doing at least once a day, you're effectively removing the floss in between your teeth, removing the bacteria, and the more often you floss, the less decay that you should have, along with brushing. So now we're going to kind of switch over to toothpaste, and there's all types of toothpaste for all kinds of reasons. I have two of these that aren't physically here. There's a toothpaste called Bite. This was the idea of eliminating waste, and they come in glass bottles. You can kind of sign up for a subscription, and they come in charcoal, as you can see, the black one, or like a regular mint. There's also flavors like lavender and lemon, but basically you take one of the tabs out of the bottle, you chew on it, it kind of foams up just a little bit with the saliva. It gets activated that way, and then you can brush your teeth with the tablets. This here, though, it does not have fluoride, so for patients who are against fluoride treatment in any way or form, Bite is a good toothpaste with no fluoride. It also does not have SLS. SLS also stands for sodium lauryl sulfate, which acts as a solvent and kind of creates like the suds or the bubbles of your toothpaste. Sometimes that kind of ingredient isn't always the best for patients who experience canker sores. It kind of helps exacerbates them. And so if you are a type of patient that experience canker sores often, you would want to look for a toothpaste that does not have SLS in it. I'm gonna see if there is a product that has SLS in it for you, so you can kind of see what that looks like. So we know for sure that Sensodyne Pro Enamel does not have it, and Periodontax is toothpaste for bleeding gums. So patients who aren't flossing as often, or gums are puffy and inflamed, if you're flossing and you're bleeding, this is the best toothpaste for you. And as you can see, the Periodontax does have sodium lauryl sulfate, and again, that's just an ingredient that kind of foams up the toothpaste to kind of give you the idea that it's giving you a better clean. Now, Periodontax, as of right now, I have Clean Mint and Extra Fresh. They both deal with bleeding gums. Pro Enamel through Sensodyne kind of repairs your enamel in a sense if you have acid erosion, so patients who are experiencing GERD or gastric reflux. That'll help with your enamel. Sometimes with the acid, it kind of strips away the strength or the enamel off your tooth and it kind of thins out. And this will help with sensitivity and with the acid erosion. Sensodyne also recently just came out with a product called Rapid Relief. This has been one of the popular ones. If you are a Sensodyne user, you will know that to effectively have Sensodyne products work on your teeth, you have to use it consecutively for at least, I don't know, they say like 12 to 14 days or so with 1 inch strip of toothpaste on your toothbrush. And this only takes 3 days to kind of desensitize your teeth versus waiting the 2 weeks for these to work. So depending on the severity of your recession or the strength of your enamel, this could be a good product for you too. I do have Colgate Total. Now Colgate Total here helps with cavities, plaque, gingivitis, your enamel, tartar, even freshens your breath, and says that it can whiten your teeth. This one comes in clean mint. This one also has the SLS in it. So again, if you are experiencing canker sores, that would not be a good one for you. I do have a whitening toothpaste they have out called Optic White for whitening. Sometimes with whitening toothpaste, it can be very abrasive on your teeth, and Colgate might be one of those that are abrasive. But if you are looking for a white teeth, and also with bleaching, sometimes one of the side effects is sensitive teeth. True White through Sensodyne is known to also whiten your teeth and help with sensitivity. So this could be a good product for you if you're just looking to kind of freshen up that white smile of yours. One of my favorite brands or types of toothpaste is Gum Detoxify. Now this neutralizes the plaque and bacteria around the gum line. It does have fluoride in it. It also comes with in the sensitive version for all-day protection if you like, if you need sensitivity. And this is just a bigger bottle version of it. And this one is a whitening toothpaste from Crest. It's a 2-step process. You brush with step 1 first, and then you spit without rinsing, and then you do step 2. Brush it with step 2 for I think another minute, and then you can rinse after this. And this is to help whiten your teeth. It also is known to help for sensitivity as well. So you guys, this kind of concludes the types of toothpaste that we have on hand and the various types of floss. If you guys have any questions, just let us know. But I hope that this video finds you with more knowledge, and I look forward to seeing you guys in the next video. And again, Hope Dental Clinic is one of the largest free dental clinics in Minnesota. It is able to offer over $2 million worth of free dental care to the community, the surroundings, and we can't do that without the gracious donors that we have and the skilled volunteers that are willing to come out on a Friday or Saturday to kind of help us give back to our community. So if you are interested, please visit us on our website at hopedentalclinic.org. Thanks again.